All right, so we've been hearing a lot about monkeypox, but how concerned should we be about this rare disease? Dr. Robert Citrenberg, infectious disease expert, advocate of rural health, is with us this morning. Doctor, good to see you again. Good morning.
Morning, Terrell and Val.
So what exactly is monkeypox and how is it spread?
It's a virus that's actually very closely related to smallpox. It's been endemic in parts of Central and West Africa for many years. What's unusual about this particular outbreak is that it's being seen in parts of the world in people without any direct contact to those countries in Central and West Africa, and it can cause lesions on the skin, it can cause fever, swollen lymph nodes, and people can get pretty sick from it. The chances of dying are very low. The mortality is somewhere around 1%, but it can be a very difficult condition for people who have it. Right now, it appears that this particular outbreak is probably spread by sexual transmission, but mostly it's transmitted by respiratory droplets or very close contact with somebody who has it.
Okay, so doctor, how concerned should we be here in the United States about monkeypox?
I think not too concerned. That the chances of having a very large-scale epidemic of this are very low because it's not nearly as easily spread as things like COVID or other viruses like chickenpox or measles. So I think we will certainly see more cases because it has a relatively long incubation period, up to 3 weeks or so. We'll probably see a lot more cases. But for the general public, unless you have close contact or direct contact with somebody who has it, the chances of you getting it are extremely low.
And doctor, even if someone does contract it, is it easy to treat?
There are no specific drugs or vaccines that are used, although because it's so closely related to smallpox, there are a couple of vaccines we actually have we don't use anymore, but could potentially be used as vaccines against smallpox that will actually work against monkeypox. And there are also a couple of oral medications that are used that can be used to treat smallpox that may be used to treat monkeypox, but that's investigational at this point. And it's interesting because we think that one of the reasons why this is spreading is because people don't get vaccinated against smallpox anymore, and so their immunity wanes, and that would make them more susceptible to a condition like monkeypox.
Dr. Citrenberg, is it painful?
The lesions can be painful, yes. I think what's worse is that patients can get fever and very swollen lymph nodes that can be very uncomfortable.
Okay.
Typically does not cause life-threatening illness, but yeah, and the symptoms can last like 2 to 4 weeks.
Yeah.
So it's not a walk in the park for people who have it, but almost all do recover.
Something else we got to watch.
Oh, boy.
Here we go. Dr. Robert Citrenberg, always glad that we can call you and ask these questions. We appreciate it. Thank
Anytime,
you.
my pleasure.
And have a good one.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.